Okay, now I will be able to share all my slides and everybody should be seeing me.
Yeah, but you have an option to, I don't see an option like you allow you to record. Maybe
I'm already recording. I'm a co-host, I'm already recording.
okay.
Yes. So I'm on the spotlight for everybody and I'm recording and I will be sharing the slides now when you guys are all ready. What time you want to start?
Yeah, just like 105, Dilip bhai, will start at 105.
That will work.
Almost about 10 people are missing. Some people are coming in. And I have made Amol as a co-host also. You can allow people in.
Yes.
Amolji, I just made you.
Okay, thank you.
And Amal, you also look at all the chat room. If you have any question which we miss, you can guide us.
Yes, absolutely. Yes.
Yeah, you look at the chat room because we have a hard time looking at the chat when you're presenting.
Yeah, I can understand. Okay.
So Shekhar, you understood what I'm saying. You know, when you do a pin or when you spotlight, it is on your view only.
Okay.
So you are the host. You can do a spotlight for all. That will be for the speaker.
Right, got it.
Is everybody watching me on the screen? Everybody, okay. That's
Yep.
Yes.
Yep, absolutely.
Thank you.
Just fairly early.
Wait.
We can just mute everybody
Yes.
and leave Dilip bhai.
Bolo. Okay. Let's go ahead and start. Boy, you guys had a time already, huh? Shekhar had prepared you. Now I'm going to prepare you now. Okay. This is going to be a very important presentation, which as a yoga teacher or as a refresher, whatever level you are joining in, will be extremely important for you. So pay a little attention. This is going to be a long presentation. And as I said, all of you have a different needs. You need a different stretch break, different nature's call break. You have to call a body break. So do it. Just take a break. And if you have to stretch, I will show it to you more and more. What we find, what really works great for a stretch break is to be able to sit down on your squatting pose, we call it Malasana, and to get up without a support. If you sit down in a Malasana, get up from the support, you will be amazed what sort of stretching it does. So here is our topic today, the anatomy and physiology. You heard this morning, after the morning presentation, the philosophy of yoga, and then you heard, you had a little Yog Nidra with Shekhar. And you will always see every time I talk, especially when I talk about for this Patanjali YogPeeth session, always mention about called the yoga. Yoga is anglicized, but yoga is the perfect name. So what we are going to discuss first, that anatomy and physiology from yogic perspective, and then we will be showing you the anatomy and physiology from Western medical perspective. In yogic philosophy, our existence in this world is in a body, mind, and spirit. And there are bodies which are connected to your physical body, which we call a sthulo sharir in Sanskrit, or you call a gross body. The body connected with your mind, we call it a subtle body, or in Sanskrit, we call it a sukha sharir. And the body connected through a spirit is called a causal body, or in Sanskrit, called a karana sharir. I will come back slowly to you how these bodies have evolved, and then I will show you another group of slides, which is not here. What are the functions of this body? What are the derangements of this body? That means called a pathology. And what are the therapy for these three bodies? Now, how these three bodies evolve, that also is one of the a surprise, not surprise, what I say, one of the most genius yogic thought process. Our yogi rishis have thought for thousands and thousands years back, and they have come up to this called the 5 koshas. So you, as a yoga teacher and as a yoga practitioner, refresher, you have to understand the 3 bodies, 5 koshas, and 7 chakras. In fact, for the chakras, we will do a separate 1-hour session with the chakras tomorrow, and we'll be doing all the practices, how to balance the chakras. Look, what are the 5 koshas? What are the fundamental concept of koshas? So if you look about our Western medical concept, we learn anatomy dissecting a dead body. So when this body has a life in it, we looked at its function. And the function is called your physiology. And when the physiology becomes abnormal, we call it a pathology. And we take care of the pathology. Pathology is basically a disease. But that physiology today, in all of our knowledge and understanding, is basically our prana, the life force. The prana which keeps us awake, alert, alive. Prana is a subtle energy which cannot be measured. It's a non-measurable energy. Breath is not prana. Breath is the carrier of prana. Metaphorically, breath will be like an electric cable and prana will be like electricity. So that prana stays in our physical body around us. And that prana is called a pranomaya kosha. The physical body is called a food sheath, which is called annamaya kosha. Annamaya kosha is we are having some food, we are breathing in the air, we are having all the functions of the physical body. Then a physiology comes, it's a pranomaya kosha. And that's where our Western or modern medical science ends. Yoga believes that this body has a mind. The mind is called a mental sheath. It's called manomaya kosha. Western medicine or modern medicine also talks about mind, but their mind is called abnormal or derangements of your neurotransmitters. The mind in modern medicine is dopamine, oxytocin, serotonin, endorphin. These are called neurotransmitters. When the neurotransmitters goes up or down, you get some kind of a mental changes. But in yoga, mind is called the content of your five senses. What does it mean? We have five senses. I hear, I see, I smell, I taste and touch. All the five senses keeps me awake, alert. But all the informations I receive through five senses, if you put it together, it becomes my mind. My mind is the input of my five senses. That's a manomaya kosha. All these informations I have in my mind, when it gets properly processed, then it becomes my intellect. And that is called an intellect sheath. That is called your Vijnanomaya kosha. Vijnana means your intellect. Intellect, Vijnanomaya kosha. Also, in yogic term, we call this called a buddhi. Buddhi is our intellect. When all these informations in the buddhis are properly processed in my body and mind, it becomes your wisdom. And the wisdom is your Anandamaya kosha, or a blissful sheath. I'm in a blissful sheath. I'm in Anandamaya kosha. So why do you need to know all these five koshas? Because in a good yoga practice, you need to balance all the five koshas. You need to do a practice to balance all the five koshas. But on the other hand, if you look at the therapeutic component of yoga, when I do the English, I try to do little yoga. When I do Sanskrit, I do yoga. So this is just our standard way of talking. Think about it. A person have underlying a medical condition. So I have always I give an example, and I try to give this example the simplest way. I have asthma. What is asthma is that called bronchioles, the small tubes which is taking the oxygen in my lung, the tube is started to close down. It is called a spasm, tightness of that bronchioles or the tubes taking oxygen to my lung. So that is an abnormality of a Annamaya kosha, my physical body. So when I have that imbalance in my Annamaya kosha, what it does, I cannot breathe. I have a breathing difficulty. So my prana is not properly coming to my body for pranic healing. So it creates an imbalance in my pranomaya kosha. So what happens when I cannot breathe properly? When I cannot breathe properly, what happens? I become anxious. I become very restless. So it affects now your manomaya kosha. The manomaya kosha is getting an imbalance. When mind is at imbalance, when I cannot think, when I'm restless, my intellect goes away. I cannot do a proper decision, proper judgment. That is called your Vijnanomaya kosha. The Vijnanomaya kosha becomes out of balance. When Vijnanomaya kosha is out of balance, what happens? Your blissful sheath, the Anandamaya kosha, also go out of balance. So they started with a simple constriction of a bronchiole or a small tubes in your lung, and it affected all my five koshas. On the other hand, if you look at it, go backwards. When my Anandamaya kosha, my blissful state is in balance, my whole body, mind, and spirit is in balance. And as I said yesterday, health is a balance of body, mind, and spirit. If my blissful state is in balance, my intellectual Vijnanamaya kosha is in balance. Suppose I start having imbalances in my Anandamaya kosha, it goes into the Vijnanamaya kosha, who is the intellect. So Vijnanamaya says, no, don't do it. This will create an imbalance in your body and mind. So still you are in balance. It comes to the Manomaya kosha, then in the mind, all the imbalance sets in. So from the yogic perspective, the root cause of all our chronic diseases, we call it an endogenous disease, which comes from inside our body, is our mind. That is called Manomaya kosha. And as I said yesterday, mind is our software. And the mind, the software, all the glitches in the software get fixed by a practice of yoga. So the root cause of all of our endogenous diseases like diabetes, hypertension, heart disease, high cholesterol, our this called a belly fat, called a truncal obesity, all are due to imbalance in our Manomaya kosha. When Manomaya kosha is imbalanced, your Pranamaya kosha is also imbalanced. So what happens, somebody whose mind is not properly working, who is in a stress, first thing you see in a stress, somebody sits in front of you in a stress, he's having some rapid breathing rate. He is doing only inhalation, no exhalation. A person in the stress will do all inhalation, no exhalation. Inhalation is sympathetic, exhalation is parasympathetic. There is no parasympathetic. So somebody looking in front of me, I as a physician, I really don't have to even examine. Just looking at his breath, I know he or she has an underlying medical condition. When the Pranamaya kosha got imbalanced, then Annamaya kosha get imbalanced. Food shit becomes imbalanced. So in a yogic practice, what you do, what you have done in the morning, done in yesterday, you have seen, when you do asana practice, asana is a Annamaya kosha, food sheath. If you create an imbalance in your asana practice, that means you overboard yourself. You don't listen to your body's signal. You are having pain. What will happen to you first? You have an interruption in your breath. Your breath catches. That means any imbalance you create in your Annamaya kosha, the food sheath will reflect Pranamaya kosha. So all the yoga practice we're going to do listening to your breathing. Your breathing has to be totally effortless. This is extremely important yogic concept. And once you understand this concept, yoga becomes is as simple as can be. So coming back, if you look at the three bodies, gross body, subtle body, and causal body. Annamaya kosha, the food sheath, is a gross body. Pranamaya kosha, Manomaya kosha, and Vijnanamaya kosha. In fact, kosha means your sheath, means a covering. These are the covering, one layer after another in the body. Pranamaya kosha, Manomaya kosha, and Vijnanamaya kosha constitutes your subtle body. This is your gross body, these three your subtle body, and Anandamaya kosha is your causal body. Next concept is our chakras. We'll come back tomorrow we'll do a big presentation in chakras, but just give you an idea so you will understand. Our yogis, when they close their eyes, when they were in a state of the meditation, we call it a dhyan, they have seen some colors in front of their eyes. When they looked at the colors, they looked at the colors of the rainbow. What are the rainbow colors? Are called vibgyor: violet, indigo blue, green, yellow, orange, red. In the same sequence, the color of your rainbow. So they thought that why don't you put in a color along the line of the spine, and where the two energy channels called Ida and Pingala, which starts from your root chakra called Muladhara chakra, the crosses, which will be an energy point and representing a system of our body. So now if you look at the 7 chakras, which we're going to describe tomorrow, the crown chakra, Sahasra chakra, Agga chakra in between it at the third eye, Vishuddha chakra at your throat, Anahata chakra at your heart level, Manipur chakra at your belly button, Shadhisthana chakra between your belly button and root of the spine, and the Muladhara chakra red at the root of the spine. But look at the sequence: violet, indigo, blue, green, yellow, orange, red. Exactly the same sequence of our rainbow. I know when I look at all this stuff and I have to share with you, then I read more and more, I cannot imagine what kind of intellect these yogic rishis have thousands and thousands years back to connected our body and mind. So what does all this chakra means? As I said, we'll be doing more and more practices tomorrow. The crown chakra, Sahasra chakra, controls or governs our nervous system. Agga chakra, the third eye chakra, controls our endocrine system. Vishuddha chakra is your kind of respiratory system. So nervous system function will be your bliss. Endocrine system, function will be your intellect. Respiratory system function is your communication. Anahata chakra, kind of circulatory system, function will be your love. Manipur chakra at the belly button, the connected digestive system, which will be your sort of your control. Your digestion controls your body and mind. Reproductive system, the Shadhisthana chakra, is your call. Procreation. We have to use the procreation to survive. And finally, at the root, musculoskeletal system, which is our power. Power, procreation, control. It is a love, it is a communication, it is your intellect and the bliss. When you look at the body, mind, and spirit, the way it is connected, our gross body is made of 5 elements. And we'll talk about tomorrow during Ayurveda, which is called Pancha Mahabhuta, 5 elements. It's called space, air, fire, water, earth. There is no Big Bang theory. Our universe first had your space. In the space came air. Air had a friction caused fire. Fire melted the cloud from water. Water froze into earth. So if you look at the 7 chakras, Muladhara chakra represents your earth. Shadhisthana chakra, pelvic chakra, represents your water. Manipur chakra represents your fire elements. Anahata chakra represents your air element. And Vishuddha chakra represents your space. Earth, water, fire, air, space. Agga chakra represents your mind. And Sahasra Chakra represents your spirit, body, mind, and spirit. 3 bodies: gross body, subtle body, and causal body. Now you see, everything is all interconnected. And these are all the chakras, 7 chakras. We'll talk about this thing in details tomorrow. What the chakras are connected, how they look like, what are the connection in the nervous system, endocrine system, what is the function, what are the mantras called chanting, lam, vam, ram, yam, hum, sham, om. We'll practice it tomorrow. Now, before I get into the human body anatomy, let me just show you a little bit of your the 3 bodies. What are the functions and other things you need to do on your 3 bodies? Whatever questions you have, please put the questions in your chat room, and we'll have a question and answer, but maybe at the end of this, because it's going to be a long presentation. Maybe at the end, I will have little time to answer some question and answer.
7 to 7 evening, much low breaks istunar.
Much what? You say something?
No, somebody was not on mute, so that's
Okay.
fine. We are
Okay.
muted.
So if you look at the 3 bodies, the first, we are seeing a nutrition, a nourishment of the 3 bodies. And when you look at it, we'll talk about your Ayurveda, you will understand. And that is the reason you have to understand some philosophy of Ayurveda. For the gross body, we call it a Sthula Sharir. The nutrition will be Vata, Pitta, and Kapha. These are your body types, which are made with the 5 elements: space, air, fire, water, earth. People with a high, big component of space and air is called a Vata. People with a fire and water is called a Pitta. Water and earth is called a Kapha. Those are your nourishment from your gross body. For the subtle body, which is really the body of your mind. And what is a subtle body? Subtle body is that you can assess your subtle body. Like for me, I have seen my body so many times. My whole body is totally imprinted in my brain or mind. So think about it. If I'm looking at you now, and if you do a brain scan, a portion of the brain will be active. It is called an optic nerve, an optical area. So I'm looking at you, I'm looking at you. My brain is getting a signal, and essentially my brain has some changes, which is called neuroplasticity. Neuroplasticity means brain gets a permanent signal, which are called, what we call it, a regular word is your memory. So now think about this. Now I totally has memorized your whole features. You are not in front of me. I close my eyes. I'm thinking about you. And guess what? If you do my brain scan, if you do a functional MRI on my brain, same area of the brain will be active. Why? Because you have an imprinted memory. The imprinted memory of the gross body is your subtle body. So what does it mean? My eyes are closed. See, I can easily touch the tip of my nose. I can easily touch my head. Easily let my left ear low. I'm touching my left index finger. I don't have to see anything in my body. I'm closing my eyes. I can clearly see I am in Houston. I'm in front of Shekhar's house. I'm entering the Shekhar's house main door. I'm taking a left turn. I'm going, passing his kitchen. I'm coming to his living room. I'm sitting down on a sofa. Absolutely, I have absolutely no problem. That is the body of my memory. That memory comes from your mind and the function of that mind will come. We call it it's called prana, teja, and ojas. Prana is called a cellular communication, which is connected to your vata. Tejas is called cellular intelligence, connected to pitta. And ojas is called cellular immunity, is called kapha. And oja is our cellular immunity. So a practice of yoga improves your body's immune power. Your immunity goes higher, as simple as it is. So what happens, that whole practice of yoga is we call it a preventive medicine. I just did a session this morning in the Facebook Live. It was yoga therapy as a preventive medicine. Prana, teja, ojas. That's why the practice of yoga became so popular for this present day COVID-19 crisis. The COVID-19 pandemic, therapy is your yoga practice. I did so many sessions on this. For the causal body, which is connected to our spirit, called Karana Sharir, this is the state of your mind. So what is the state of your mind? We call it Satta, Rajas, and Tamas. Satta means your purity of your mind. We'll talk about it a little bit more tomorrow. Rajas is the activity of your mind. And tamas is the dullness of your mind. And most of all these, in Indian subcontinent, all of you, there are food. We all talk about food, how food is controlling our body. In yoga and Ayurveda practice, food creates your mind. There is a term, Sanskrit term called jatha an tatha man. Jatha an means your food. Whatever food you eat, it controls your mind. That's why all the food described in Indian subcontinent and from the yogic and Ayurvedic perspective are called sattvic food, rajasic food, and tamasic food. Something is stale food, something food which is left over. Tamasic food. Food which are very good for your mind, purity of your mind. Sattvic food. Sattvic food you use for your spiritual practice. Food which makes your mind very active and stimulant is called a rajasic food. Onion, garlic is a rajasic food. These are the concepts you understand. Now you think about why I'm talking about this. Once you understand this, you'll be amazed how easy it becomes your yoga practice and how easy yoga becomes your dinacharya, daily routine, and how easy yoga becomes your lifestyle. Yoga is a lifestyle. It's you practice. It's not that I practice 1 hour, 2 hours of mat. It is what you do outside your mat. So in a physical body, in a physical body, it is the body which is an energy. People, we have all these scientists here, software engineers. What the body is equal to E equal to mc square. Body is an energy equal to mass times velocity square. Einstein's theory, as simple as it is. The body is the energy which comes from information through your 5 senses and which will be composed, wrapped around DNA. DNA is our basic body structure which comes from your food and water. The dearrangement is your, as I said, physical diseases of our body, healing, healing substances, food, water, herb, pharmaceuticals, and the treatment is to restore the balance of our imbalances called the doshas, vata, pitta, and kapha, to ward off your pathogens and mainly integrating your physical body. And physical body will come and show you a little later. When you do even asana practice, you need to know which kind of muscles you're active. One very important thing about this physical body is the state of your mind. So what is the state of your mind is that when the first your mind is awake, it's called a jagroto. You're awake. From the awake state, you go into called a dream state. It is called a shapno. From the dream, you go to a state called your sleep, which is called a shupto. And here, when it comes to the sleep has called a rapid eye movement sleep, REM sleep, and we call a non-REM sleep, non-rapid eye movement sleep. When you get a rapid eye movement sleep, that sleep is mind is still very active. In non-REM sleep, you get into slowly you get into deeper sleep. There's a 4 stages of non-REM sleep: stage 1, stage 2, stage 3, stage 4. Stage 1 and 2, almost 50% of the sleep. 3 and 4 is the deep sleep. When you get into the deep sleep, then you get into enter into the another state of mind, which is called turiya. Turiya is essentially a transcendental mind practice. We use the term turiya anand. Turiya anand. When you sleep very well, when you get into a 4th stage of sleep, and when you get up from that sleep, suddenly you get totally disoriented. You really even don't know where you are. You don't know when you are sleeping. That is a state of turiya. So what happens in the yoga practice, your mind quiets down. So essentially you stay in the stage 1 and stage 2 of the sleep. So when you go to sleep, you quickly get into stage 3 and stage 4 sleep. When you get into that sleep, you don't need much sleep. So very interesting. Most of the yogis don't need too much sleep. So people ask me, how long am I going to sleep? 6 hours, 8 hours, 10 hours? I said, no, time is not in the sleep. Sleep is the stages. If you get into stages, so we have a few people who are very concerned. So we are, we call the word we use, a very bad term called health nuts. We all health nuts have one of these. And hopefully you guys know what are these, huh? This is my Apple Watch. You can have a Fitbit. Remember, this thing is continuously tracking my health parameters. And we wear it during our yoga practice for simple reason is that all the things we're talking about, health benefit of yoga, we are not talking anything nonsense anymore. We have the documentation here. Guess what? Apple Watch came up with a study. The Apple Watch can predict a COVID-19 about a week before a person develops COVID-19. How it does? It senses a phenomena called a heart rate variability. If you have any healthcare in the audience, which we have few of us, you will understand healthcare had a heart rate variability, which is really a representation of your parasympathetic tone. Sympathetic tone is measured by is called the cutaneous resistance. But heart rate variability is from your parasympathetic tone, and the practice of yoga always activates your parasympathetic tone. The subtle body, which is the body of your mind, which is called Sukha Sharir, as I said, when you close your eyes, you know where you are. So the composition is your thoughts, your emotions, and your impression. And dearrangements will cause a psychological disease. Healing substance will be positive thoughts and actions. Your practice, pranayama, meditation. And most important therapy is to ward off negative emotions. Like we call it, you inhale positive emotions and exhale negative emotions. And inhaling love, inhaling gratitude, inhaling all the positive things you can think, and you are exhaling all of your anger, jealousy, greed. We call Sharo Ripu. Kam, Krodh, Lobh, Moho, Madh, Matsarju. You have the English word for all of them. Kam is the last. Krodh is anger. Lobh is your, lobh is what do you really?
Greed.
Greed. Yes. We've been so much of use to Sanskrit now, forgetting English. Now we don't remember English. Okay, greed. Okay, lobh. Okay, moho. Moho will be lust.
Moho is desire.
Desire, okay.
Calm is lust.
Lust, yeah. Moho is a desire. Then what do you come next? Kam, Krodh, Lobh, Moho, Madh, Matsarja. Madh is your envy. You do the hingsha. And Matsarja will be, what will be the English word for the Matsarja will be? These are we call Sharo Ripus.
Is jealousy.
Jealousy, okay. Good. So you have to ward off all these negative emotions. And these are very well written in our yogic transcript, yogic philosophy. So subtle body is like that when you are doing especially, say, Yog Nidra. There's a difference between a Shavasana and Yog Nidra. Yog Nidra is a lot deeper than a Savasana. And you had a practice of Yog Nidra today. Shekhar has done it. But at the level of the end level of your Yog Nidra, when you're able to tap your subtle body, you have a feeling of your levitation. You feel like you are not even touching your mat in the ground. So this is your gross body here. I hope you could see my mouse pointer, and this will be your subtle body. See, subtle body is having a sense of levitation. It's a wonderful practice. And you keep on doing it, and it became totally experiential. And it comes to a point when you can tap your subtle body that you won't be able to describe to anybody. We say there is no language. There is no language to describe your experiential expression. So that is called, practice of yoga is called work in. And practice of your exercise is called work out. You said, I'm working out. What is working out? You're exercising. I'm working in. What is working in? I'm practicing yoga. Very, very important concept. Causal body or spiritual body called Karana Sharir, it is your spirit, and it consists of the sum of your karmas. And the Causal body is exactly when you are able to tap into your turiya. Turiya is your transcendental state of your mind. So to remember this mind. Jagroto, awake. Shapno, dream. Sleep, shupto. Then it comes turiya. Turiyanan. The Turiyanan in our Indian language, our even writers they use the word Turiyanan. Turiyanande, I'm from Bengal, it's here. Turiyanande chute chuli. Ami unmad means I'm running and I'm feeling the effect of Turiya Anand. Composition is a past life karmas and will of the soul. The arrangements in the lack of purpose in life and the creativity. Healing substances are dharma. Dharma is, what is a dharma? Is the law of the nature which keeps our microcosm to the balance with macrocosm. We'll talk about a little bit more tomorrow. The Jatha Pinda Tatha Brahmanda. And you will understand this more and more when you keep on doing the yoga practice. And that's what I said, first day. Yoga is a 90% practice, 99% practice, 1% theory. When you keep on doing these practices, this thing will come to you. Dharma will come to you. When you do the yoga practice, you will know that you are not going to tell a lie. It will all come from within you, and it will come to a state of called let go. Let go. You will be able to steal your mind for 24/7. Treatment is soul searching, self-discipline, self-discovery, introspection, looking inside you, self-realization. I make fun all the time. I said, you know what self-realization is? Self-realization is developing a real eyes. And what is the real eyes? Real eyes is the eyes turned backwards. That means instead of looking out, now you're looking in. You are looking into yourself. You're realizing yourself. And the goal is to ward off ignorance and sorrow. So let's talk about a few minutes about koshas, and then we'll go to our Western anatomy and physiology or modern medicine anatomy and physiology. Koshas are also very important, and for your chakras, we'll do it tomorrow. So what is koshas? It is said at the level, when there's a 5 koshas, what is at the center level of koshas is your Atma, is your soul, body, mind, and spirit. And these koshas are essentially along the central line, which is the chakras, and it is a representation of your mind. And I said, all the koshas, the center is your Atma, is your soul. I showed it to you, 5 koshas, and if you can look at all the koshas will be all around, and you have to remember the name of all the koshas. And once you remember, it will all come to you. You don't have to, even if to think, it will be etched in your mind. So what are the nutrition for the koshas? How do you take care of the koshas? Annamaya kosha, very simple, physical body, air, water, food, removing your waste, malas, like your, sweat, urine, stool, carbon dioxide exhalation. So the beauty of your practice, all the waste material we have a stool, which I have to have a process for stool to remove. I have a urine needs to come out. My perspiration, actually perspiration is called the mala. Mala is your excreta. But the biggest toxins we have sitting in our lung, all the carbon dioxide, as I told you yesterday, 6-liter capacity of the lung, of which 1.5 liter always stays to keep the lungs little inflated. 4.5 liter I can exchange. Voluntarily, I can remove my toxins of my body. That's a practice of yoga. And that cannot be done by any medication, any practices anywhere in the world. So Pranomaya Kosha, the nutrition will be pranayama, which will be doing it. Shekhar did again last night, this morning. We'll be doing again this afternoon. You'll see. We'll be doing pranayama practice. I did this morning, hour and a half. So if you guys are interested, you can go to my Facebook page, or that will be uploaded in my YouTube channel. You'll see the whole practice of pranayama already. Manomaya Kosha is your meditation, mind. We'll talk about what is the mind, what is meditation. Meditation is quieting down the mind, not the way you think. Our mind has thought process, continuously generating thought process, thousands and thousands of thought process daily. But guess what? A majority of the thought process is in the past, a lot more in the future, very few in the present. That's what yoga says. Practice of yoga is living in present. But even the thoughts in the present, you have a repeat thought process. This repeat thought process is called chitta vritti. So what the yoga practice does? Called chitta vritti nirodha. See, the Yoga Sutra, chitta vritti nirodha is an outcome of yoga practice. So in a meditation, what you do, you enter in between the thought process, which is called a gap. And in that gap, keep on extending the gap bigger and bigger and bigger until you still have the thought process, but you don't have the repeat thought process. That's called chitta vritti nirodha. For intellectual sheath, Vijnanama is just reading scriptures, very important yogic scriptures. And for Anandamaya Kosha, blissful service is called a selfless service. In yoga, it's called a nishkam karma. You have a karma yoga. Karma yoga has to be nishkam. Nishkam means no desire. No desire. And nishkam also means if you have a unusual result from your karma, you are going to take care of that karma. So we will talk about balancing all these koshas, your chakras, and we'll talk about a little bit tomorrow. We'll talk about it. And so this is, you will be getting all this thing as a recorded, so you will keep it as for your future references. And that's what I create all these slides, and I'll give it to you. Let's do one thing. It's 5 minutes to 3. One of my friends wrote a book. The book is called Sitting Kills Moving Hills. Sitting is your next smoking. So let's take a 5 minutes break. You answer Mother Nature, do some stretch, come back around 3 o'clock in 5 minutes. We'll go over with your Western medical practices. Okay, if you have any questions, you can put it in your chat room and I will be able to see it in this break time.
Yeah, everyone, 3 o'clock is Eastern time.
Eastern time, yes.
2
yes.
o'clock is our
Central time.
The break is only for 5 minutes, please.
All right, you got it. Yeah, this break is called stretch break, or maybe when you talk, I will go ahead and drink some water because I had a lunch. It's about an hour past lunch, so I'll drink some water. People talks about when you're talking, they drink some water. We are in a state of called parasympathetic activation. We get a saliva in our mouth. Our mouth is always wet. People who are sympathetic, people who are talking, they get a stress. That's the time they keep on drinking water. Okay, but my water taking is my 1 hour after my lunch. This is 1 hour after your lunch, isn't Shekhar? Yeah. What time is it? 2 o'clock, huh? Acha.
Yeah,
I'll be
yeah.
back in a minute. So, just a minute for that. Okay. Can you hear me?
Yes. Yes.
Yes. Okay. Shekhar, my AirPod Pro didn't work today. There was a lot of static. I don't know what happened. So maybe tonight I have to use the open microphone. So I'm using my corded. Corded works fine, you know.
Hmm.
Are you using AirPod Pro? You are using AirPod?
Yeah. For my Pro.
Pro.
For my session.
Yeah, I have the Pro, but when I put the Pro, I got a lot of static from Zoom. It happened to me before also. And
it was good. And sometimes if there's question or something, I can hear them very well also through the AirPod. So I'm very happy.
Only thing is that I'm finding it only happens in my Zoom meeting. You know, I have a WebEx, but I have a cell phone. It doesn't have any effect. Okay, we come back. So let's start talking about little anatomy, which Shekhar really likes it very much when you talk about the physiology. And the reason is, why do you need to know this? Because you as a yoga practitioner, first of all, you need to know at least a gross anatomy. What is a gross anatomy means? You need to see the human body from the perspective of layer after layer. So I have a skin. Underneath my skin, there is a fatty tissue called subcutaneous tissue. Under subcutaneous tissue, there is called one facial tissue called fascia. And the fascia is a big thing in yoga practice. If you look at all the yoga literature, everybody talks about fascia. Underneath is your muscles. Under the muscles is your bones and joints and the body cavities. And your most important anatomy will be the body cavity. Why? You need to know what is underneath is your chest cavity. What is in your abdominal contents? Where is your liver? Where is your stomach? Where is your spleen? Where is the small intestine, colon? What is the lung? What is the heart? What is the diaphragm? Because all of them will come in your yoga practice. So here, it is called a body cavities, thoraco-abdominal cavities. So why it is important as a yoga practitioner? Because this internal organ gets massaged in many asanas and pranayama practices. And also, you remember, any asana practice, if you look at from our medical perspective, asana is an alignment. It's an external alignment. That means it keeps your bones and joints in proper alignment, and it gives a proper shape to our body. Our body shape changes with the asana practice. Asana is also an internal alignment. What does it mean? I am doing a Bakrasana. I'm doing a Bakrasana, I'm twisting. We have seen in the Bakrasana, my blood flow to my kidney gets better. So if you can see my mouse, here is your kidneys. And there is a main vessel called an aorta, main blood vessel. The blood vessel will come to the kidney, it opens up. Or if you do an Ardha Matsyendrayanasana, then an ultrasound of the gallbladder. There's a gallbladder which underneath your liver. Gallbladder opens up and gallbladder clears up. So in a chest cavity, on the both sides, there are two lungs, right lung and a left lung. Lung has 3 segments, upper lobe, middle lobe, lower lobe on the right side, and the left side is the 2 segments, upper lobe and the lower lobe. In between lungs is the heart. From the heart, the main vessel comes out. One is called aorta, it's called aortic arch. Then it gives arteries, which one goes to the right side of the neck, one goes to the left side of the neck. In the right side, it divides. One goes to a right arm, and the left side, one goes to the left arm. Then the main vessel comes down. This is called aorta. It divides into two branches called iliac arteries. It goes to both sides of the leg, called femoral arteries, popliteal arteries, goes all the way down to your leg. And we'll talk about it. Inside between the abdominal cavity and the thorax, it divides into called a diaphragm. It's a muscular organ which is supplied by a nerve called a phrenic nerve. Very important nerve from yogic perspective. Two nerves you have to remember. One is called a vagus nerve and one is called a phrenic nerve. Vagus nerve is called parasympathetic activity, and phrenic nerve supplies your diaphragm. Why? You'll see Kapalbhati Pranayama. All the things you're doing, you're hitting the diaphragm. Right side is going to be the liver. This is your stomach. This is your spleen. Behind is a pancreas. So look at that. If you know the anatomy of pancreas, pancreas is a long organ all the way to the back, which is responsible for causing your diabetes. So in a diabetes practice, if you understand this concept of pancreas, if you do any spinal manipulation asanas, what are the spinal manipulating asanas? Bakrasana, Ardha Matsyendrasana, or if you do a Yog Mudra. So you are really flexing, doing the bending of your spine. Essentially what you are doing, you are holding the pancreas and literally you are squeezing the pancreas to get the insulin out of the pancreas. So if you understand this anatomy, you'll understand the yoga practice for diabetes. Same way, if you understand all the organs here in the body, then you know any dysfunction in the organ, when you do a Kapalbhati Pranayama, you get massaging of those organs. Kapalbhati Pranayama will massage your liver. Liver has the Agni, called the Bhuta Agnis, Pancha Mahabhuta, Akash, Vayu, Agni, Jal, Prithvi. Stomach has the Agni, called your Jathar Agni. Pancreas has the Agni, called a Kloma Agni. Those gets Agni Deepana. So Kapalbhati Pranayama is called the Prano Pradhan Pranayam. Agni Pradhan Pranayam. It's a metabolic pranayam. Your Bastrika Pranayam, active inhalation, active exhalation, Bastrika Pranayam is your Prano Pradhan Pranayam. It brings the prana within your body. And alternate nostril breathing is your Vayu Pradhan Pranayam. Very, very important reason for you to look at this and understand this very well, the body cavities. So the body, what is the body? From a Western perspective, it's a different system, anatomy, functions, and the physiology, and is treated by the allopathic medicine. Mind, on the other hand, is a perception through your five senses. As I said, mind is a container of the five senses. When those container of the five senses get processed, it becomes buddhi, becomes your intellect. When your buddhi becomes more processed, it becomes your wisdom. Very, very important concept. Wise, who is wise? Wise person is a person who knows how to properly use your five senses, the information of the five senses. Consciousness. Consciousness is your perception through your five senses. So look at the word we use. Somebody is unconscious. What the term, English term we use? Called it senseless. Person becomes senseless. That is called your unconscious. And it is your psychology, which you treat by psychiatry. Psychiatry takes care of your mind. Spirit was the exact purpose of spirit is the purpose of life. Who am I? Why am I here? And where am I? Answers are very simple. When you practice yoga, you will have answers of all of them. Who am I? I'm probably nobody, huh? Keep on taking out the layers. Who am I? I was a physician. Take out the layer. I'm a man. Take out the layer. I'm a human being. Take out the layer. The moment you take the layer out, who am I? Essentially, it becomes you are your essence, your soul. That's what you are. Why am I here? Probably interact with another soul. Impact of belief on the physical body is absolutely important. Like if you have a belief, it has a physiological effect. And this is treated by your integrative medicine. Psychology of belief. Like if you believe that you are here, if you believe that you are here to have your practice, you believe that you are here to listening to my body, you are already start getting healing. Very important concept of belief. And that's the reason people go to you go to church, you're going to temple, you go to synagogue. Where are you going for? You're going for your underlying belief. And that's a healing substance. People who attend your spiritual services, they had a better healing, they have a better control. As a very simple example, somebody has a cancer, diagnosis of a cancer. He or she said, that's it. I have a cancer, I'm going to die. They do die. They do die in a short period of time. And the person has a cancer, said, no, I'm happy. I'm going to give a fight. I believe in all the therapies I have. I believe the support system. I believe all my friends will help me. I believe my church, or I believe my temple. They do live longer. No question about it. We see it all the time, every time. So the whole body at the bottom is your skeletal system. Skeletal system is the one which you have to know a little bit more. It is the bones and joints. And we're born with X number of bones, and then children, the bone starts to fuse and keeps on fusing, and a lot of bones get remodeled. Very important, if you know a hip bone called a femur. Femur has called a head of the femur, neck of the femur. This is a very beautiful structure of the femoral bone. But look at a baby's femoral head doesn't have anything. But it molds because of the pressure it is applying on the bone. So think about it. Very, very important concept. People come and say, I want to do yoga for osteoporosis. Osteoporosis is you are losing calcium, losing mineral from your bones. So what will be your yoga practice? Will be your weight-bearing, grounding, and supportive practice. You can think about any way you want. You can do a Virabhadrasana and warrior pose. Very good for your osteoporosis. You can do very good grounding your Trikonasana, triangle pose. So the bones enables you to stand, and it protects all the soft organs like a skull and brain. But more important, you have to know that here I am sitting. I'm sitting for hours and hours here in front of my computer, especially many of you have a software people. You do sitting in front of computer, you do hunchback like that, look at a computer, you're killing yourself. Our present experience and present observation is the highest number of our lifestyle related disorders today are from the IT people. All the software engineers are getting into the highest number of diabetes, hypertension, heart disease, high cholesterol. So all my muscles, everything is keeping me straight, Because if there is no muscle tone, nothing, my whole skeleton will fall in the front. So it is keeping me straight. So what I'm doing, I'm keeping myself straight. This is called a kneeling stool. Very important for yoga practice. Yoga practice, I sit down in the kneeling stool and I always keep my spine straight. And that's what you understand when you're looking at a skeletal system. So here is skeletal, and you will get, we'll share all of them with you. So you'll have it. This is the skull. This is your orbital cavity. This is cervical vertebrae. Between the vertebrae, there is a, we call it a disc. It's like a cushion, herniated disc. You will know, we'll talk about it. It protrudes, it comes out. These are the ribs. This is the scapula in the back. This is called a humerus. It's a ulnar and radius. The hand is a lot of called a carpal bones. Very important, the pelvic cavity. These are the ribs which are protecting the thoracic cavity. Pelvic cavity is supported by the two hip joints. So what happens when you relax your hip joints, when you're able to do a good, your, say, Baddha Konasana, closed angle pose. You put your feet together, put your knees on the side, relax your hip, it relaxes your pelvis. When it relaxes your pelvis, the junction between the pelvis and the spine, which is here, this is the site for your called herniated disc. Because pelvis is fixed, spine is moving. When fixed and moving, a sudden shear, you get a herniated disc. When your pelvis is flexible, when a pelvis is moving with your spine, you do not get a herniated disc. So if you have this concept, anatomical concept in the yoga practice, you become a better and better yoga practitioner and better yoga teachers. Same way, if you look at a hip joint and a knee joint, these are transmits your body weight. But it is your ankle joint and the feet which is supporting all of your body weight. So your practice will be primarily to relaxing the ankle joint and relaxing your feet. You'll see, we do call it sukha, the subtle yoga practices. One thing I always like to tell you, there is a difference between exercise and yoga. Exercise is sympathetic. Exercise is to build your strength and stamina, but which is very important, very important. Don't even ignore it. We do it. We do a weight training, we do a treadmill, we do Surya Namaskar, we do yogic jogging, but all boils down to do it slowly, gradually, behind your breath. We are also concerned about knee joints and hip joints. Largest number of operation for the knee joint replacement and the hip joint replacement. But yoga takes care of your here, ankle and feet. Separate your toes. So the toes are separated, toes are relaxed. We'll do it. The practice will show it to you. You put your finger in between the toes, keep the toes relaxed. So just looking from the back, the skull again, the vertebrae. This is our cervical vertebra, thoracic vertebra, lumbar vertebra, and sacral vertebra. Parasympathetic tone comes from your called craniosacral, means head and the sacral area, and sympathetic comes from called thoracolumbar, chest and the lumbar area. Here you can look at all the spines, and this is the area called L4 and L5. That's where the herniated disc takes place. Here it is. These are the two called vertebral bodies, and this is called a disc. And there is a covering for the disc called annulus. When it breaks down, it comes out, and the spinal cord is here. It compresses on the spinal cord. Spinal cord is here in this opening, and the herniated disc affects here. Same way, it is a section of your knee joint, This is called the femur, the upper bone, and the tibia, and between that we call a cartilage called meniscus. This is called a meniscal tear and causes knee pain. But the important thing is this cartilage don't have any pain fiber. So when you have the cartilage damage, it's called osteoarthritis. People call it cartilage damage, I get a pain. No, you don't get a pain for that. Body, what it does when you get damaged, body causes your splinting. What is splinting? Body tightens up your ligaments, tightens up your muscle to keep this joint at rest. That causes your pain. Pain fibers in the ligaments, pain fibers in the muscles and the tendons. So when you do the yoga practice for pain, we do relaxation of the ligaments and the muscles. Muscular system, which covering all the bones and muscles are connected to the bone to move the bones and to protect our body cavities. There are two types of muscle. One is called voluntary muscles and the involuntary muscles. Voluntary muscles are called skeletal muscles. So what it is, say our muscles of respiration. So all the muscles we use to breathe, muscles we use to do pranayama, they're connected with my arm, called pectoralis major, latissimus dorsi. You will see they're all connected to my arm. So if I do an arm balance, if I do an arm strength, if I can able to do a good Tulasana, raising my whole body high up, Bakasana, I can do a Mayurasana, Mayuriyasana. When I have a hand strength, my pranayama practice gets better. And these muscles are called skeletal muscles and they can be trained. Like if you're doing a biceps curl, you're doing 5 pounds, second you can do it. Within 2 weeks, you'll be able to do 10 pounds. Then we'll do the 15 pounds. You can train your biceps muscle. Same way you can train your respiratory muscles. Today you can do 2 seconds in, 4 seconds out. If you practice, you'll do 4 seconds in, 8 seconds out. Take it 8 seconds in, 16 seconds out. We've been doing so long, we can do easily 10 seconds in, 20 seconds out. Our respiratory rate is very low, very simple. So here is a gross body, all the muscular system. So if you look at it, all the names are there. I'm not going to go through, but that is the way it protects. So most important yoga practice is keep the muscles relaxed. And yoga side is called a Sithilikaran asana. Sithilikaran. You have to do a relaxation of the muscles instead of tightness of the muscle. And most important relaxation is your abdominal wall. When the abdominal wall is relaxed, you'll be able to do a very good Agni Sarkriya. You'll be able to do your Kapalbhati Pranayama. You'll be able to do Uddiyani Bandh. There is a nice yogic statement. It says, Pet naram. Pet naram means abdomen is nice, softer. Pet naram, sir thanda. Head, calm and quiet head. Pet naram, sir thanda. Maro daktar ko danda. Daktar ko danda means you don't need any doctors. When your abdomen is soft, your mind is calm and quiet. That's what the outcome of the yoga practice. These are the terms sometimes you can come. It's called the agonist and antagonist. These muscles are working, this muscle relaxing. That's the way that yoga practice starts. So if you're looking, say, it's called your reciprocal inhibition. So you are doing what asana is this? Janu Sirasana. But remember, you are doing this in stages. Arambho, Sthiti, and Visarjan. Remember, these 3 terms are very, very important. Beginning of the asana is Arambho. Sthiti is when all the fasciculation goes away. Visarjana is a profound relaxation that happens due to this, your circuitry, what is doing through your motor nerves, reciprocal inhibition. Nervous system is absolutely a must for knowing yogic practice. It is a brain, spinal cord, and the network of nerves. So, which controls our whole body. So the nerves, which you need to understand, first is one is called your voluntary nervous system. Voluntary nervous system is from all the spinal cord, all the nerve comes out, and I can control. I'm closing my hand, opening my hand, I'm doing on my own. Voluntary nervous system. This next one called involuntary nervous system. Involuntary nervous system is I look at a food and I get some secretion in my stomach. A very famous experiment. A Russian experiment is called a Pavlov pouch. Pavlov used to do open up part of your dog's stomach, take a look at it, but it was up here, it's upstate in Michigan. There's an island called Mackinac Island. There was a physician named Beaumont, William Beaumont. And the patient's name was Alexis St. Martin. And the story behind it is that Alexis St. Martin was shot in the abdomen. This is about 150 years back. When the thing was all healed up, part of his stomach was exposed outside. And William Beaumont could look at his stomach and studied the whole nervous system. They gave him a food, and he see the stomach started having secretion of the stomach juice, acids. Oh, great. After a while, he started showing him the food, not giving him food. Stomach still starts having this acids and juice. He described called involuntary nervous system. Then it's called autonomic nervous system. Autonomic nervous system is called sympathetic nervous system and parasympathetic nervous system. And autonomic is called that I have no control. It comes from all the fibers from the brainstem and also from the lower part and all the spinal cord. But what happens for the yogis? Yogis being practicing yoga, relaxation response, activation of parasympathetic tone for so long that they also have a control over their autonomic nervous system. So if you look at a yogi, before, I could never believe unless they can walk on a glass, they can lay down on a bed of nail. They can hold their breath. They can stop their heart. Have they been shown it? Swami Rama came here in 1969. He said, I can stop my heart. The cardiologist showed it to me. He was hooked up. And he voluntarily controlled his heart. Brain also have some nerves called the cranial nerves. There are 12 cranial nerves. We memorize the name: olfactory, optic, oculomotor, trigeminal, abducent, facial, vestibulocochlear, vagus, glossopharyngeal, accessory, hypoglossal. These cranial nerves gets stimulated and acted by your yoga practice. So eyes have 4 cranial nerves. One is called your optic nerve, olfactory, optic, a second nerve, it's called optic nerve. Then eye muscles are supplied by 3 cranial nerves called SO4, LR6. Lateral rectus is muscle by the 6th nerve, superior oblique 4th nerve. So when you do a tratak practice of yoga, you're activating 4 cranial nerves. That means the nerves coming from your brain. Very, very important concept. Same way, when you do your forward bend, all the thoracic, sympathetic comes from your chest and the lumbar area. Parasympathetic comes from the craniosacral, from the brain and the sacral area. It is just to show you a little bit what is your brain and the spinal cord looks like. One very important yogic concept is that yoga talks about right brain and left brain. A right brain is called intuitive. Right brain is female. Right brain is cooling. So right brain is controlling your left nostril. So left nostril is cooling, Chandra Nari. Left nostril is parasympathetic. Left brain is analytical. Left brain is heating. Left brain is male, which controls the right nostril. So right nostril is called your Surya Nari, sun energy, Pingala, and sympathetic. So these are the gross things you have to understand. Is very, very important. These are all the distribution of the nerves, and all the nerves first comes out from your spinal cord. These are called plexuses. It's a lot of plexus: cervical plexus, brachial plexus, lumbar plexus, and most important one nerve is called the sciatic nerve. It comes on in the back behind your thigh all the down, and sciatic nerve gets involved in your herniated disc, and this is one of the yogis are always looking into it. It lies on a muscle called a piriformis muscle. And when it gets irritated, remember the back pain comes from the irritation of the nerve. So what happens, irritation of the nerve, you get a tightness of the muscle, and tightness of the muscle causes pain. So this nerve is sitting on a muscle called a piriformis muscle. And piriformis gets tight, you get like a stabbing pain in the back. So the piriformis relaxing asana, Ardha Matsyendrayana asana, is your piriformis relaxing asana. Piriformis syndrome is a very popular term these days. So to know about this sciatic nerve very well. So autonomic nervous system, as I said, all the nerves which is coming out from the head and neck area called cranial area are called parasympathetic. The nerves coming out from your chest and the lumbar area are sympathetic, which comes from the bottom is called the sacral area. This is a greenish one. These are the parasympathetic. So called a craniosacral. Cranium means head, sacral is the lower part, parasympathetic, thoracodorsal is your sympathetic. So when you are doing a thoracodorsal yoga practices, it is quieting down your sympathetic nervous system. And these are all the organs it supplies, and organs which are going to be affected when you are doing the parasympathetic and sympathetic activation. Phrenic nerve is, as I said, very important nerve, comes from your cervical area, comes down, supplies your diaphragm. And the diaphragm is a very important structure from all yoga practices. It connects because there inhalation and exhalation, and I'll show it to you why the diaphragm is so important. I'll come back a little later and show you a few more before I finish. Endocrine system is very important in yoga practice because we got called a altered hormonal homeostasis. Like our hormone level changes, and especially with the women. All the women's symptoms, when they get a puberty, when they get started their period, when they get a premenstrual syndrome, when they get a painful menstruation, dysmenorrhea, got a more blood coming out during period, menorrhagia, menopausal symptoms, all due to your hormonal imbalances and your autonomic nervous dysfunction. Hot flushes is an autonomic nervous dysfunction. So main important is your pituitary gland, which is called a master gland. Another called a pineal gland, which you say we connected with your spirit. Then is a thyroid and parathyroid gland. And all the glands you will see were connected to your chakras. Pineal gland is connected to your Sahasrara chakra. Pituitary gland is connected through your Agga chakra. thyroid and parathyroid connected to your Vishuddha chakra. There is a called a thymus connected to your Anahata chakra, heart chakra. There's a pancreas, and the pancreas called a beta cells, which is connected to your Manipur chakra. And your gonads, testis and ovary, connected through your Shadhisthana chakra, pelvic chakra, and your Muladhara chakra ground is connected through your called adrenal gland, adrenal cortex. Very, very important. So you have to learn how to regulate, how to control this hormonal dysfunction through the yoga practices. So you will see more and more when I will be talking about, I'll talk about your pituitary gland, I'll get a thyroid gland, I'll talk about the pineal gland, which is a spirit, adrenal, sex organ, and then also called a lymphatic organ. Digestion is very important because what happens, digestion is done through your parasympathetic activation. When you eat food, food converts into 7 tissues called saptadhatu. Rashadhatu, Raktadhatu, Mangshodhatu, Metodhatu, Ostidhatu, Majjadhatu, Shukradhatu. So all the yoga practices, relaxation, it activates your digestive system. Digestive starts from the mouth. This is called the esophagus. And here it's the same channel. Either it goes to the lung, it's called your larynx, or through your pharynx that comes to the esophagus. So remember, if I breathe through my mouth in, I don't know where the air has gone. Either it has gone to the lung or in my stomach. But if I breathe through my nostril, all the air has gone through my nose. Nose is a personal air conditioner. It has a channel which guides everything into my lung. So esophagus goes into your stomach, and stomach is the duodenum, small intestine, large intestine, come to the sigmoid colon, rectum, and the anal canal. An anal sphincter you pull up is a Mulabata. We'll be practicing Mulabata. Respiratory system, which is very important for the pranayama practice. As I said, there will be your 3 segments of the right lung, 2 segments of the left lung. The air comes in through is called the trachea. It starts branching into called bronchiole, and branches and branches. It makes 23 branches before it gives you called alveoli. It's like a sac. One side is your air, other side is the blood. So you get an exchange. The blood, the oxygen will come to your blood, and from the blood, the dirty carbon dioxide will come, it will come out. So all the toxins will come out and fresh air will go into your body. So the cavities you have, this is the chest cavity, the abdominal cavity, and the diaphragm, as I said, phrenic nerve, it controls. And more you are relaxed, you will be able to expand both. So what happens in Kapalbhati Pranayama? You are hitting your abdominal organ, like your belly button, you're pushing it back, it hits your diaphragm, hits your lung, and air comes out. So prana and apana is very important concept. The 2 balloons and 2 balloons you are controlling with your practice. The muscles for the bandhas. So when you are doing the bandhas, you are doing your Jalandhar bandha, you are activating called a carotid sinus, and also this is the vocal cord and the laryngeal area. When you're doing your Uddiyani bandh, you are sucking, breathing out, taking a deep breath in, breathe out, suck your stomach in and hold, and you're activating your the negative intra-abdominal pressure. In the Mula bandh, you're controlling pelvic floor and pulling it up. So we are getting close to your time. Let me show you a couple of systems, because this we'll be talking about all the time. The circulatory system, we say already talked about you, heart, main vessel comes down, all down to the leg, and then all the blood comes back called a vein, and the main vein is called the inferior vena cava, which is on the right side. So what happens in a person who is pregnant, when they're doing a yoga practice, you don't let them lie on the right side. In the right side, the enlarged uterus will compress, blood return will be less. Excretory system is also very important, which consists of urine. And you remember one thing, all the excretion is done. Intestine is the bowel, skin has a sweating, lung is your breathing. In excretory system is a kidney, that is called a ureters, there is a bladder and your urethra. And most of the thing, like a kidney failure, you work with a Kapalbhati Pranayama. Reproductive systems are very important. For women, it's the uterus, tubes, and ovaries. And in a process called your infertility, or called a syndrome called polycystic ovarian syndrome, PCOS. Therapy is all from your Kapalbhati Pranayama. Same with the men with a prostate problem, your massaging is done through Kapalbhati Pranayama. Lymphatic system is very important because lymphatic system gets all guided by your pranayama practice. When you do pranayama, the lymphatic channel brings all the fluid up because you have a negative thoracic pressure. Chest pressure becomes down, so all the lymphatic channel goes high up and it joins in the vein. And if you have a swelling, that means your lymphatic system is not working. A pranayama practice helps relieving your lymphatic system. So now, before I get into some questions, I don't know how many questions you have, but I want to show you a few poses and look at the muscles and anatomy, how it works. The goal is a seated pose. Remember what is that? It's called Sthiram Sukham Asanam. Pelvis and legs support the spine. The spine supports the skull. Protect the brain, spinal cord, and support and helps pranayama and meditation. So, most important asana, which really keeps you properly relaxed, is your Vajrasana, is your Padmasana, lotus pose. So when you're doing a Uttanasana, look at what is happening to your muscles and the skeleton and the whole abdominal cavity. Relaxes the knees, relaxes the hips, allows the spine to release. It's a profound effect of yogic asana. We call it external and internal alignment. The Vakrasana, Brikasana and a Gorurasana, eagle pose. These are very complex, but it creates an internal equilibrium. We call it balancing pose. These are the balancing pose, and you will see I will be practicing so much of balancing poses because health is a balance of your body, mind, and spirit. To create the balancing poses. The Trikonasana. So the muscles which is working in Trikonasanas. You cannot imagine. All the abdominal organs get massaged. All the lateral muscles, arm muscles, thigh muscles, leg muscles, and all the internal contents get massaged. Therapeutic asana. We say, remember we used to say, one apple a day, keep the doctors away. We say one Trikonasana a day, keep the doctors away. Malasana. See how beautiful a Malasana is? And I will show it to you. When you do the Malasana, with your hand together, putting the elbows inside, look at all the organs which are getting affected with the Malasana. Most profound relaxation response. You can even engage all the three bandhas in Malasana. I wake up first thing in the morning, I sit down in Malasana, drink a glass of water, and I get a first thing within a short time. I get a perfect bowel movement. Paschimottanasana. Look at all the muscles which are working in a Paschimottanasana. Gomukhasana. When you become Gomukhasana equally on both sides, it is a balancing pose. Most important balancing pose and the most important therapeutic pose is a Gomukhasana. Trikonasana, Gomukhasana, Vajrasana, Mundukasana, Sasankasana will tell you all these things in the practice. Could do this evening. Vajrasana, most relaxing asana. It activates your parasympathetic tone, keeps your spine straight, heads up. And what it does, it affects your digestion. So I'm sure you have seen our parents and grandparents used to sit down in Vajrasana after a big meal. This is the only asana we practice after a full meal. We all practice whole yoga in an empty stomach. Little bit of food is okay, but not the whole meal. Baddha Konasana. It relaxes the hip joint, quiets the mind. It's very important. And the way to do it, the way I do it, I do a Baddha Konasana. I put myself against a wall. I put my spine straight and wall. I'm doing pranayama practice. I do all my pranayama practice in Baddha Konasana and keeping my spine straight. Pavan Muktasana. And look at all the effects of Pavan Muktasana does in your body cavities. It's a wonderful practice. Sarvangasana, Salamba Sarvangasana. You know, you will see all the inversion poses, Sarvangasana, Shirshasana, all of them we do in stages and it comes to us. Halasana. Dhanurasana. Look at the muscles you're using in the Dhanurasana. Adhumukha Savasana, downward facing dog. Mayurasana, Bakasana. These are the asanas you need for your proper pranayama practice. Maybe we'll do it this afternoon. Urdhva Dhanurasana, Bhujangasana, Shalamba Sirsasana. Let me finish here and let me see what you have. If you have any questions here, and I can stop sharing. You can.
Okay, I have a question.
All right, go ahead.
I was asking about what asana you said for the piriformis muscle and sciatic.
Oh my God.
What was the name of the asana?
I already forgot what I said, you know.
Ardha, you started with Ardha.
Oh, I know what I said. I'm just saying, you know, once we talk, yogis doesn't remember anything. No, I'm kidding.
Yeah, I know.
Ardha Matsyendrayanasana.
Matsyen.
How about we'll do it this evening?
Yeah.
You do the Bakrasana, and the Bakrasana, you put your both the knees on the top, which is called a Vaisa Asana. Vaisa Asana is, you know, you look at a Vaisa. Vaisa, you know, they put one foot on the top. Then you bring it, put your one hand outside of that. Ardha Matsya Endrayan Asana is the therapy for Piriformis Syndrome. And Piriformis Syndrome is a very common syndrome today.
Dilip bhai, we did after Vakrasana this morning.
You did today.
After Vakrasana, we did the Ardha Matsyendraya Asana.
So
Right.
you had already treated your Piriformis Syndrome. I didn't see it, but
okay.
I know.
So there are some questions in the chat.
Why don't you go ahead and read the questions so that, you know, because it's too small for me to read, you know.
Yeah. So one question is there a research on yoga and dementia memory loss? Mind is so important with all philosophy connects to soul. Thoughts on dementia or brain failure?
Yes, there is a tremendous amount of research is done. So if you're interested, go to PubMed, PubMed, PubMed.org. PubMed.org is the National Library of Medicine website, and all the research publications are there. So you'll go into your search engine, you'll put down yoga or yoga therapy and dementia, and you'll be surprised. You'll have probably over 1,000 articles will come up. Today, even if you put just a simple yoga therapy, you will have over 5,000 current articles are there in a PubMed, PubMed. Also, you can do, if you're all good in Google, there is a product called a Google Scholar. Anybody used Google Scholar here? Wonderful, wonderful source. Use Google Scholar. The moment you type Google Scholar, all the research will come. So please go ahead and look into it. And I have all the data, everything, because I teach physicians. When I teach physicians the yoga therapy, I do a continuing medical education. I became a lot more. Whatever I showed you today, it is a very tamed down version of what I teach to the physicians. Okay, next question. I have 5 more minutes.
Namaste, Dr. Sarkar. My name is Pradnya. I really enjoyed this session. However, in my mind from past few months, I'm conflicted about the diet part of Ayurveda. So we talk mostly about vegetarian diet. But when I discuss this subject with my colleagues who are from other parts of the world, such as Germany.
Can I interrupt you, please?
Yeah.
Can you talk about this anatomy? Because diet we'll talk about tomorrow during Ayurveda, and we'll discuss.
Okay, sure.
More.
I'll save my question for tomorrow.
Talk about. Can you read the other questions related to what I presented today? I know you all have questions, and we'll have an open question and answer session tomorrow for about hours and hours. You can ask any question. Now, because of the lack of time, Amal, can you read the other questions that you have related to what I presented today?
So the next question is, you mentioned endogenous diseases are all caused by our own mind and they can be cured by our own mind. But what about exogenous diseases like COVID-19?
Sure. All the diseases what we have, we call it exogenous disease and endogenous disease. Exogenous disease is coming from outside. It's a virus with the toxins. So what you need to do to fight the exogenous disease is our immune system. So what happens, your immune system gets very strong with your yoga practice. How does immune system get strong? Very simple phenomena. The question the last lady was asking about the diet, we talk about the yogic diet. We're not concerned about the food, what you eat. You know what the yogic principle is? You are not what you eat. You are what you digest. Food has to be digested. So what it is in your practice, the food gets proper digested because food digestion is due to parasympathetic activation. Our whole gastrointestinal tract, starting from mouth all the way up to anal canal, is supplied by parasympathetic nerve. Like when you yoga practice, our mouth gets wet because this parotid gland secretes our juice. When you are sympathetic, fearful, mouth gets dry. So in food, when you eat food, the food converts into saptadhatu, 7 tissues. Rashadhatu, Raktadhatu, Mamsadhatu, Medodhatu, Ostidhatu, Majjadhatu, Shukradhatu. Plasma, red blood cell, muscle, fat, bones and joints, nervous system, reproductive tissue. Then it forms a substance called ojas. The ojas is our immunity, or cellular immunity. Prana is a cellular communication. Teja is a cellular intelligence. Ojas is cellular immunity. So when you have the cellular immunity with your practice, you also resist your exogenous disease. Okay, next question. What do you have? Can you read it for me, Amal?
Yes. What is the difference between exhalation from nose or exhalation from mouth, and which one to do when?
Okay. You never use mouth for any kind of breathing. Mouth is to talk and to eat. But if you breathe in through your mouth, you don't know even where the air has gone, whether the air has gone to the lung or to the stomach. You always breathe in through your nose and breathe out through your nose.
But doctor, one Mukhadauti is there where when you raise your heartbeat, you do out through the mouth, right?
Okay. No, it's all these things, you are the concepts. Take the concept first. Now somebody says, I have a problem breathing through my nostril, but keep practicing. Do Jalneti, do Sutraneti, which will show you tomorrow. We all have a problem. At the beginning, if you cannot do it, then what you can do, you breathe in through your nostril, you breathe out through your mouth.
That's right, yeah.
That is normal physiology. See, what you are learning here is the physiology. You are not going to think about the practices people does. Everybody does a practice in all different way based on their even own experience. So what we teach people, if you read a book, your book, read a book from your source. What is the source? Hatha Yoga Pradipika. Read Hatha Yoga Pradipika. Do not read all this, I won't say trash, and all the books in the market, which has no meaning. Yoga is a philosophy, came from Veda. It is Atharva Ved. Rig Ved, Sham Ved, Yajur Ved, Atharva Ved. It's a part of your Atharva Ved. Read from the scripture, you learn more. Okay, next question.
Okay, I think the next one is probably more of a, can you please show the kneeling stool chair that to use and recommend any specific brand model?
Okay, how about specific brand model today? It's called Amazon.com. Huh? go to Amazon.com, put a kneeling stool. Okay, I will show it to you during practice this afternoon. Okay, I have to get and because of the lack of time, I'll show it to you during my practice. But Amazon.com, put a kneeling stool, or just you won't be able to, because if I see it, you won't see it. Just to show it to you. You want to see it? This is the stool. You sit down.
Oh, okay.
No backrest needed for that kind of stool then. No backrest.
It always keeps your spine straight. You cannot bend. So all the IT people here, you all get a kneeling stool working in front of computer. Okay, next question.
All right. What could be asanas, pranayama for throat, tonsils, or stones?
We are not talking about anything, anatomy, physiology. See, questions, we'll talk about it all the time when you do the practice.
Right.
Okay.
Next one says, when I try to attempt the Janu Shirshasana, I feel extreme stretch in my head and I feel acute pain when I try to descend and bow down.
So you're not.
You know what might be the reason?
Yeah, you're not listening to your body. You back off. Back off and stay in that pose. You develop called neuroplasticity. And you develop the neuroplasticity also. I'll show it to you during practice. Even if you do Shirshasana, how do you do Shirshasana? Oh, you were 70, you were 80, Right? Iyengar was doing Shirshasana when he was 95. He was doing Shirshasana for 8 hours because he was doing it from his childhood. So all of this, what happens, you go in stages, and I'll show it to you how we do stages. Any kind of symptoms you have during asana practice, you back off. But you stay in the posture. Stay in the posture 10, 20, 30, 40 times, it will all come back to you. Then again, remember, mind over body, software over hardware. Software get fixed. You can do any asanas. You don't even practice, or asana will come to you. I think it's end of your time. Thank you for all the questions. I am a little bit always in time, finish on time, and always try to answer questions pertaining to the presentations. Next is Shekhar, you take me out from the spotlight first if you start your session. and you put yourself on the spotlight for everyone.
Where to find you?
I can do that. Let me do that.
Okay.
See if you can. All right.
You're
great.
in a speaker view. You're in a speaker view now. Just a moment. If I see, everybody see Sarkar?
Yes. Yeah.
Okay.
Yep.
Right. Good afternoon. Thank you very much, Dr. Sarkar. Wonderful presentation. A lot of things to learn, as always. It's time for some break. Let's get fresh. We have till 3:30 Central Standard Time. We have Dhyan. We have a presentation on pranayama. And then we have a practical session, a good yoga session with Dr. Sarkar also. So take a nice break and come back before 3:30, please. And we'll carry on.
Yeah. 3:30 Central, 4:30 Eastern.
Yes, please.